most people, they think chiropractic is for back pain, diba? Right? You have back pain, you go to the chiropractor. Well, back pain, that is just a symptom that there is some type of stress on the central nervous system. Most likely, there's some type of a misalignment, maybe in your hips, or maybe your spine is going forward. You have subluxation, and that's affecting the nerve. And yes, that causes back pain. But what most people seem to forget is, remember, our nerves communicate to our organs, like our heart, our lungs, our liver, our kidneys, our stomach. Everything communicates via the central nervous system. So these subluxations or these misalignments, they disrupt that communication. So our body is not working efficiently. And so we're prone to have a weakened immune system. We're getting sick more often. But if you care for your central nervous system, your body's working more efficiently. So as your organs work more efficiently, your immune system is stronger, your lymphatic system is working, your body's working properly. And so our goal, especially at my clinics, we really focus on overall health, well-being, and prevention of not only caring for your spine, but most importantly, the central nervous system with very, very specific, gentle spinal adjustments.
Dr. Rob, I think this is a very important question. Who are allowed and who are not allowed to undergo chiropractic treatment or adjustment? Dr. Rob? Right.
So first of all, chiropractic is extremely safe. When you take a look at the world, so many adjustments take place every day in US and Europe. It's a very, very popular form of care. Chiropractors use a different amount of pressure and force depending on who we are adjusting. So chiropractic is very safe for babies, for children, all the way up to elderly. Some in the 90s and the 80s. Luckily, it doesn't require a lot of force to adjust babies and elderly. Very, very, very little bit of force is needed to just gently mobilize the joint, again, freeing that nerve, improving body function, improving sleep, improving quality of life, improving pain and health. So it's very, very safe. As far as who can't get it, it's very, very rare that we need to tell someone, yeah, I can't help you. But there are occasions, if somebody is so severe, if we need to refer out for an x-ray or an MRI, sometimes we will do that, and they can still come back in, and then we can go over their x-ray and MRI findings. But it's not very often that we need to send away.
Attorney, I just want to ask this question. Before you start, Dr. Rob, before you start the procedure, what do you consider, or what do you want to find out from your patient? Let's say, for example, I am interested, attorney, I am interested. What do you want to find out from me?
First of all, the most important part is the history taking. We need to know your age. That tells us so much. Of course, if you're 40 years old, that's 40 years of accumulative stress on your spine. And of course, by the time we're in our 40s, we're already showing some signs of wear and tear in our discs. Maybe medyo osteoarthritis is developing. And then if you're in your 50s, maybe medyo spondylosis is developing. So we learn so much based upon just what we see in front of us. If you're looking strong, if you're looking weak, based upon your age, what are your symptoms? Do you have numbness, tingling in your arm? Do you have numbness, tingling in your leg? So we learn so much through the history. And then, of course, we're then doing motion palpation, posture analysis, so we can really identify with our hands, but sometimes we do take an x-ray.
Thank you, Doc Rob.
Yes, Doc Rob, earlier you said that it's so safe and that it's okay even for babies. So just for one final clarification, are we very sure that even children are okay to have chiropractic adjustment? Although you said this already, no? We just want to be very, very sure.
Yes, Paul. Yes. So oftentimes the first subluxation occurs at even just the birthing process. A lot of rotation is used, a lot of pulling is used. So babies that are having a hard time, going to the bathroom, maybe they're crying throughout the night, Maybe they're getting chronic ear infections. These are all signs that there possibly is a disturbance on their central nervous system. So some people want to do more of a holistic approach to health. Maybe they don't want to give medicine. And so chiropractic is a great way to improve the body's function naturally. So yes, we're very effective at getting rid of ear infections. You know, baby moms have called me crying, oh my gosh, my baby went to the bathroom for the first time in 4 days, just by very gentle spinal adjustment. Babies, kids come in, you know, that are ticking, they have nervous tics, they've got, you know, autism, they've got all these neurological issues, and chiropractic helps. Again, it's kind of more of that natural way by allowing the body's nervous system to start to operate properly. So it's very safe for kids. When you think about like a baby learning to walk, when they're 1 year old, think about how often they're falling down and the hips start to shift. Hindi pantay, right? The hips shift out of alignment, right? And so these are the start of the problems. And then maybe the spine's going to start to become scoliotic. So the younger you start to care for your spine and the frame and the pelvis, the better.
Okay. So that is a very good assurance for everybody who has small children or babies. You can go to a chiropractor like Dr. Rob for chiropractic adjustment. Okay, Ma'am Annie, it's your turn now.
Thank you very much, attorney. He made mention about the alignment. The alignment. Let's say, for example, you have a spine. You need your spine to be aligned, and then you have a joint problems, and then another problem in your neck. Can you do it in one session, Dr. Rob? Para makatipid.
Yes. Chiropractic it's very different than it's very different than a therapy where you're there for an hour getting your muscles worked on. A chiropractic alignment is mabilis. It's only 5 to 10 minutes. It's not that long of a procedure. So yes, we can do the spine. We really focus on the spine. If somebody has another joint that is subluxated, sure, we can adjust those other joints, but we really focus predominantly on the spine and the pelvis because of the nerves.
Okay, so meaning to say you can do it in one session.
And spine, including the neck. Of course, we focus on the neck.
Very good.
Yes.
Okay, I like your answer.
Yes.
Thank you very much. Tipid. Okay. Okay. Yes.
Okay.
Go ahead, attorney.
Dr. Rob, I'm a normal person, but how would I know that I am in need of chiropractic adjustment if I don't feel anything?
That's
what
correct.
are the signs that my body needs it? Or even if I'm not feeling anything, do you think that there is a possibility that I would also need chiropractic adjustment?
Very good question,
Dr.
attorney.
Rob? Thank you,
so good
Ma'am
question. So as we age, we have things going on. Even though you might not feel pain, but we still have things going on. Maybe your range of motion isn't what it used to be. Maybe you notice your neck doesn't turn as well as it used to. Or maybe you notice your sleep is not what it used to be. Maybe you notice your digestion is not that good. These are all signs of malfunction due to the accumulative stress on the nerves. So again, by just getting that tune-up, by getting that spinal adjustment, by improving that nerve function, you'll notice improved sleep. You'll notice that range of motion starting to come back. You'll notice digestion improve and energy. So even though you don't have pain, most likely you start, again, as we age, we all are kind of going through some things. But to answer your question more specific, if you have no pain and you're not feeling anything, I am a believer that, yes, we should still be under some form of care because our spine is still degenerating. As we age, our spine is aging. And so studies really show if you keep that joint lubricated, you keep that mobile, you actually are keeping your spine healthy. And the majority of our nerves are responsible for the function of our body. Only 10% is devoted to sensory, to pain. 90% is devoted to the function. So majority of the time, we don't have maybe a symptom, but there still is a problem. it's a much like analogy with the teeth. You don't wait until you have a toothache to brush. You floss and brush so you don't get decay in your teeth.
Yes. Dr. Rob, you have generated interest amongst us with what you have explained to us earlier, that it's safe. And even if you're not feeling anything, we can still go to you because we might not know that there's something wrong with us. So for those of the people who have heard you speak and who want to undergo treatment or maybe advice from you if they would need treatment, where can they find you? How will they get in touch with you, Dr. Rob?
Okay, so we have 6 branches now. 6 branches. So the best way is by our website at docrob.ph. That's docrob.ph. That's our website. You can go there. You can learn about all of our locations. We have 6. Our phone number is 0905 444-8172. Yeah, and I urge you to come in and have a consultation, and that way, we can really sit down and discuss what is it that your goals are, what do you want to, attain, and then I can really explain, what chiropractic is and how it can help you attain those goals.
Okay, Dr. Rob, I will not let you go after this. I need to know where those 6 centers are. Dr. Rob, can you please enumerate? Tell us, where are those 6 centers?
Okay, number 1 is in Quezon City. Number 2 is in Makati.
Okay.
Number 3 is in Alabang. Number 4 is in Bacoor. And then we have 2 in Pampanga, Angeles. So that's 6. Yeah, sorry.
Okay. Dr. Rob, one more question. Are you the one actually doing the treatment, or do you have other chiropractors? Okay. And if we want it to be you, if, for instance, somebody is watching now and they want it to be you who will be handling them, where amongst the 4 centers can they find you? 6 centers, right? 6 centers.
Okay, so amongst the 6, we have six branches. Yeah, I bring licensed, great chiropractors from abroad here, but I still do practice. I'm in Quezon City. That's where I am located. So if somebody were specifically just to want me, it would be Quezon City.
All
Okay.
right. Okay. Thank you so
Very
much.
good.
Miss Annie, wala tayong problem. We are in Quezon City.
Yes. We can try
Dr.
that because Attorney
Malapit
Dot.
na, ha? Malapit.
Attorney Dot.
See? Good, very good.
I heard some people, Attorney Dot and Dr. Rob, I heard some people with migraines, after seeing their chiropractor, they find relief. So,
Wow.
Doc Rob.
Madaling, very madaling.
Very magaling.
Okay.
Sige.
That's very easy.
magaling.
Madali
Ayan.
Yeah,
lang yan.
headaches, migraines. Super magaling. Yes po. We can
Super
really
magaling.
help so many things.
Oh,
Yes.
okay. Super.
Ayan. Okay. So,
Okay.
Attorney, I am convinced now. So, we will advise
Yeah.
our
very
listeners
good.
and our
Okay.
viewers, di ba? Hindi na ako natatakot. Ayan. You can visit
Yes,
your
you guys come here
chiropractor
together. I'll take care of
as
you.
open as necessary. Yan.
Yan.
Sige. Okay, Attorney Dot.
Okay. So,
Opo, go ahead,
yes,
please. Thank you.
Dr. Rob, we had a wonderful time talking to you, and thank you for sharing with us your information regarding chiropractic treatment. And of course, Dr. Rob, we will not let you go unless you greet your team and, of course, your very beautiful wife, Miss Patricia Javier.
Okay. My team, they work so hard, and they know I love them. So hello to all my team out there, and to my beautiful asawa ko. I love you, and thank you so much. See you soon.
Thank you very
Ayan, ang
much po
sweet. Nako.
for joining
Ang
us this
sweet naman itong
afternoon.
asawa rin. Oo.
Opo,
She's,
ang sweet.
she's really very beautiful.
Thank you, guys.
Napakaganda, Miss Patricia Javier. So at this point,
thank
since we
you.
don't have any more time, yes, we would like to invite you again, hopefully in the near future. But at this point, we have to say bye-bye for you. And thank you so much, Dr. Robert Walcher, a chiropractor who practices here in Quezon City. Thank you so much.
Good afternoon.
Bye.
Thank you very much.
Yes,
Stay safe. Thank you so much.
Bye-bye.
Bye-bye po. Salamat sa Diyos.
Bye.
Okay, Dr. Robert Trump.
Ayan.
Magandang hapon po. And Attorney Dot, sa ating
Yeah.
mga nakikinig,
Yeah.
kung natatakot kayo dun sa chiropractor.
Bakit nagtatagalog ka na? Bakit
Eh, tapos na
nagtatagalog
tayo.
ka na?
Nakaalis na siya. Talaga naman, attorney, naubusan.
medyo
Opo.
nahirapan ako doon.
Okay. Alam mo,
Okay.
talagang kapag araw-araw meron tayo ditong guest na
Napapractice.
mga ibang lahi, napapractice tayo. Salamat sa Diyos. Ayan. At saka ito yung kasama ko, professor pa. Si Attorney Dot. Talaga naman. Salamat, Attorney. Maraming salamat. Okay. Attorney, sa lahat ng ating mga kababayan na nakikinig, ano po, yung takot sa chiropractor o yung explanation niya, hindi na tayo makatatakot kasi doktor naman talaga siya at saka lisensyado. So, hindi po nakakatakot. At may mga trained din sila mga tao. I will try that one day. Attorney?
Miss
sa ating
Annie,
mga
narinig mo,
Attorney Dot.
narinig mo.
Opo.
Ang
Opo.
sabi niya, sabay daw tayo. Susunduin kita, sabay daw tayo. Okay, deal.
Okay.
Pagtapos doon, kakain tayo sa labas. Ititreat kita. Sama natin si Ma'am Lynn, tsaka si Jillian, tsaka
Ayan.
si lahat sila.
Okay.
Sige, okay.
Talaga naman,
Sige,
ayan.
alright.
How I wish, man. I don't know si Miss Jackie kung nagpa-chiropractor na yan. Okay. Chiropractic treatment. Chiropractic care. Ayan. We will pause for a break for some reminders at magbabalik po tayo after this. Thank you po.